Case Study 1. A 65-year-old male patient is admitted to the hospital with a diagnosis of hypertension. His blood pressure is 161/100ths of a millimeter of mercury. The healthcare provider prescribes hydrochlorothiazide, HCTZ, a thiazide diuretic. Which of the following statements by the patient indicates an understanding of the medication's action? A. This medication will help reduce my blood pressure by blocking the angiotensin-converting enzyme. B. This medication will help reduce my blood pressure by promoting the excretion of sodium and water. C. This medication will help reduce my blood pressure by blocking the beta receptors in my heart. D. This medication will help reduce my blood pressure by blocking the calcium channels in my blood vessels. Correct answer, B. This medication will help reduce my blood pressure by promoting the excretion of sodium and water. Rationale. Hydrochlorothiazide, HCTZ, is a thiazide diuretic that works by promoting the excretion of sodium and water, leading to a reduction in blood volume and subsequent decrease in blood pressure. Case Study 2. A 45-year-old female patient is being treated for depression with sertraline, a selective serotonin reuptake inhibitor, SSRI. She reports feeling restless and having difficulty sitting still. The nurse suspects the patient may be experiencing an adverse effect. Which of the following actions should the nurse take first? A. Administer an antipsychotic medication. B. Discontinue the sertraline immediately. C. Educate the patient about the potential side effects of SSRIs. D. Assess for other signs and symptoms of serotonin syndrome. Correct answer. D. Assess for other signs and symptoms of serotonin syndrome. Rationale. Restlessness and difficulty sitting still can be signs of serotonin syndrome, a potentially life-threatening condition that can occur with the use of serotonergic medications like SSRIs. The nurse should first assess for other signs and symptoms of serotonin syndrome, such as agitation, confusion, rapid heart rate, high blood pressure, dilated pupils, and muscle rigidity. Case Study 3. A 30-year-old female patient is diagnosed with type 1 diabetes mellitus. She will be started on insulin therapy. Which of the following statements indicates that the patient understands the proper administration technique for insulin? A. I will inject the insulin into my thigh muscles. B. I will inject the insulin into my upper arm. C. I will inject the insulin into my abdomen. D. I will inject the insulin into my buttocks. Correct answer. C. I will inject the insulin into my abdomen. Rationale. The abdomen is the preferred site for insulin injection because it has a consistent and predictable absorption rate. Injection into the thigh, upper arm, or buttocks may result in variable absorption rates and affect blood glucose control. Case Study 4. A 50-year-old male patient with a history of chronic obstructive pulmonary disease, COPD, is prescribed albuterol, a short-acting beta-agonist bronchodilator. The patient asks the nurse how this medication works. Which of the following responses by the nurse is correct? A. Albuterol works by reducing inflammation in your airways. B. Albuterol works by thinning the mucus in your lungs. C. Albuterol works by relaxing the smooth muscles in your airways. D. Albuterol works by blocking the histamine receptors in your lungs. Correct answer. C. Albuterol works by relaxing the smooth muscles in your airways. Rationale. Albuterol is a short-acting beta agonist bronchodilator that works by selectively stimulating the beta-2 adrenergic receptors in the smooth muscles of the airways. This stimulation leads to smooth muscle relaxation and bronchodilation, improving airflow in conditions such as COPD. Case Study 5. A 60-year-old male patient is admitted to the emergency department with chest pain. He is diagnosed with acute myocardial infarction, heart attack. The healthcare provider orders aspirin for the patient. The nurse understands that aspirin is prescribed for this patient primarily due to its A. Anticoagulant effects, B. Vasodilatory effects, C. Analgesic effects, D. Antiplatelet effects. Correct answer. D. Antiplatelet effects. Rationale. Aspirin is prescribed for patients with acute myocardial infarction due to its antiplatelet effects. Aspirin irreversibly inhibits platelet aggregation by blocking the enzyme cyclooxygenase, COX, which is involved in the synthesis of thromboxane A2, a potent platelet aggregator. By inhibiting platelet aggregation, aspirin helps to prevent the formation of blood clots in the coronary arteries and reduce the risk of further cardiac events.